Hello and welcome. I'd like to introduce you to the Safe Environment for Every Kid, or SEEK, model of pediatric primary care. What is this model? SEEK offers a practical approach that addresses prevalent psychosocial problems and thereby strengthens families, supports parents, and enhances kids' health, development, and safety, and helps prevent child abuse and neglect. What's the evidence? 2 randomized controlled trials have yielded very promising findings. To help disseminate the model, we've created a series of videos to educate primary child health professionals on how to implement the SEEK model in your practice. First, here's the background as to why we've spent more than a decade developing the SEEK model. Preventing child abuse and neglect is so important. Why? It is really common. About 700,000 reported cases are substantiated each year, and we know this is just the tip of the iceberg. Most abuse and neglect occurs behind closed doors, often kept as a dark secret, and go undetected. A slew of studies are summarized in this slide. In both the short and long term, child maltreatment impairs children's physical and emotional health and their social and cognitive development. Abused and neglected kids are more likely to have medical and mental health problems. They're more likely to be juvenile delinquents or adult criminals, and they're more likely to have learning problems and poor academic achievement. So, as a result, child maltreatment has a huge economic cost. We're paying about $120 billion a year, and that's a conservative estimate. Another reason to prevent child maltreatment is a moral one. Children suffer terribly from abuse and neglect, so there's a compelling moral imperative to help prevent children from being abused and neglected. I actually think that there are several reasons why pediatric primary care offers a terrific opportunity to try and help families and to help prevent child abuse and neglect. One of them is that we're talking about a whole system that's already in place. It's well accepted by parents, so we're not talking about building a whole new infrastructure. Also, very often, most of the time, parents and pediatricians or family practitioners, nurses, have really good relationships. And so this is taking advantage, building upon those good relationships. In the first few years, there are lots of visits, and so that offers a good opportunity. Prevention is really at the heart of pediatric primary care. Also, for a long time we've known how important parents, parenting, and families are to children's health and development. So we have this terrific opportunity and arguably responsibility to help strengthen families, support parents, and thereby improve kids' health, development, and safety, and help prevent child abuse and neglect. What was needed to help PEDS primary care practitioners accomplish this model? They needed an efficient, practical approach with useful tools. We targeted problems that were highly prevalent, associated with child abuse and neglect, and where resources are generally available. SEEK targets risk factors that include parental depression, substance abuse, intimate partner violence, major stress, food insecurity, and harsh punishment. Let's now turn to the SEEK model, which includes training health professionals to play this role. This is important to help them be competent and feel comfortable tackling the targeted problems. We developed and evaluated the SEEK Parent Screening Questionnaire. This is a brief screening tool that parents can complete before the child is seen. A brief assessment. We've developed guidelines for this, mindful of the time constraints in a busy practice. Also, we've incorporated the key principles of motivational interviewing. For example, assessing a parent's stance towards the problem and tailoring one's response accordingly. This departs from the traditional approach of simply telling folks what to do and instead developing the plan with them. Initially, addressing the problem. Sometimes this involves brief guidance. Often it requires facilitating a referral. Seek resources. We develop parent handouts for each of the targeted problems that can be customized with info on local resources and for a practice. Another resource has been a list of commonly used community agencies. Finally, the SEEK model has included a social worker. This is definitely ideal. It could also be another kind of professional able to help address psychosocial problems. Clearly, many practices do not have such a resource. That requires that the medical professional conducts the brief intervention, and a staff member can help facilitate referrals. SEEK offers a practical approach for improving PEDS primary care, and the evidence is really solid, supporting its effectiveness. We want to encourage you to implement this model in your practice, and also to go through all the modules that will help prepare you for doing this. The SEEK questionnaire may be administered on paper or through the web-based system called Chattis, which provides decision support, electronic documentation, and patient educational resources. The SEEK model may also be implemented as a quality improvement program with an option for formal maintenance of certification credit.